that's going to be. And then also, if you'd like to turn your camera on or off at any point, please feel free to do so. So with that being said, I would like to kick off with introducing our Vice President of Operations, Melissa Barnes, who is also the sister-in-law of Patrick Barnes, who the foundation is after. And so with that, Melissa, please say a few words to start us off.
Thank you, Chelsea, and thank you all for taking your time to come and learn a little bit more from some of the very best programs that we have here in Washington State. I have to say that when my family started the Daisy Foundation almost 24 years ago, 24 years this November, never in a million dreams did they ever think it would grow to be over 6,200 partner healthcare facilities and schools of nursing, with over 2.5 million nominations written, a true testament. Patients and families, they want to thank their extraordinary nurse. And to be able to shine a light on all of the right that happens every single day in your hospitals is what Daisy is all about. So much good that nurses do. No wonder they're the most trusted profession. What's really exciting about today's roundtable is, of course, many of you, I hope, know the Daisy Awards' very first presentation was done right here in our own University of Washington Medical Center. And so with that legacy, I am happy to turn it back to you, Chelsea, and I hope you all enjoy the program.
Wonderful. Thank you, Melissa. I am happy to introduce our first speaker and co-host of this event as well, Maciel Seeger. Wonderful. Let me get back into this. Maciel is the Administrative Program Manager and Daisy Coordinator for Multi-Care Tacoma General Hospital in Tacoma, Washington, and I am so excited for her to be able to share how she makes her program so successful at her facility and really be able to highlight some of the ways that she markets the program and really encourages those great nominations that she gets. So with that, I will turn it over to Maciel.
Thank you, Chelsea. Hi, everyone. My name is Maciel Seeger, and I've actually been a program coordinator for about 11 years at Tacoma General here in Washington for about 2 years. But the remainder of my history with Daisy goes back in California, and I worked at the University of Irvine, and we launched the program there, and it's been very successful till my leave, and it was handed over to somebody else, but now I'm happy to continue that work at Tacoma General. So with that, I will share some best practices. Give me 1 second. Okay, I hope you guys can all see my screen. We good? Thank you. Okay, so Daisy program at Tacoma General Hospital. So marketing and promotion. So one of the things I did starting my position there at Tacoma General, I just wanted to make sure we were marketing and promoting Daisy everywhere we could. I started off by putting these flyers here that you see on the left-hand side, and we add the QR code to make it easy for visitors and patients to just get their phones out, click, and they're able to make a quick nomination. This in itself has been a very beneficial tool for us. We put these in patients' rooms. We put them in all the common areas as well as our elevator. So I think the more traction we get is on the elevator because our elevators are a little slow. So when visitors go up, they kind of look around and they see it. We have a designated area for it, and it's very visible. We also have these Daisy banners that, of course, we purchased from the Daisy Foundation website. And we did have the QR code added, in which, again, that's been of a great benefit to us because I want to say 80% of my nominations come through electronically. And so we put these in the common areas. We have one designated in the ER and our visitor patient waiting area and cafeteria. We also like to highlight our honorees. And so throughout the year, we have posters that have our honorees pictures and their name and the unit where they work at. And this works well because a lot of the visitors stop by and they like to just stare at the pictures and then they have questions of what is Daisy. And so nearby we have the banner and again, the QR code and the link, the website link where it gives you more information. We also have these nomination boxes that we put in every unit, and some of them have two depending on the size of the unit. But again, we have the hard copy nominations, and these are pre-postage stamped, so they come directly to me. And this is also a good way to promote it. Best practices for collecting nominations. So what we do at Tacoma in general, we have a few ways that we collect nominations and how we really advertise for people to nominate. So one of the things that is really helpful is what you see here is our discharge package. So in the discharge package, in addition to all the instructions and educational information they have for the patient, we also add a DAISY nomination form. And this has worked well for us. And a lot of the patients really see a benefit because they're sick in the patient. So when they get discharged, they're feeling better and they would like to recognize at that point their nurses. Another thing we do is we have the employee Tacoma General newsletter, and this is beneficial for us for the Teams Award and the Nurse Leader Award. And I will see if this actually works, and it takes me to that, so then I can give you an example of what it looks like. So here is our Tacoma General newsletter. And again, ways we market and promote, we always make sure that we have the DAISY nominee honorees posted and highlighted. But we scroll down, we put our annual call for the DAISY team nomination. Again, this is a great way. This goes to all staff. So we get a lot of doctors, we get therapists who want to nominate their whole team that's led by a nurse. And this is a great way how I get my nominations. Same thing with the Nurse Leader Award. This is one particular award that a nurse can actually nominate another nurse. So I do this quarterly, and I definitely get a good number of nominations through this. Going back to so rounding cards. We have small business cards like rounding cards that nurses use, and it has a QR code and also has the link to the actual nominations. And so this is great for us because we're able to just when the nurse managers are doing the rounding, and some patients like to share stories with the nurse leaders. So then this is a great way for the nurse said, oh, I love the story you just shared. Would you like to nominate your nurse? And so they give them the card, and that's an easy way for them to nominate. Sorry. Again, the QR codes on the flyer and the banner, really helpful, easy access to patients and visitors, nomination boxes in all areas. And I want to show you guys what I do. So for nurse leaders, in addition to the newsletter, I also send out a mass email to all staff for Nurse Leader Award. And I want to show you how I send it out. Usually this is how it comes out. They could either do it on their phone or they can just do an easy click and it takes them to the electronic nomination form. Okay, award presentation. So we really want to make the ceremony meaningful to every honoree. So what I do is, of course, I have the basics. We put the bag together, we put the certificate, the Healer's Touch Award, the Cinnabons. But what we also do here at Tacoma General, and I've done this in my previous organization, I make sure I do specific scripts for the director, the CNE, and the manager. And the reason for this is because I want to make it meaningful. There's a lot of new nurses out there, and they might not know what the DAISY Award is. So the director opens the ceremony and introduces the senior team, which is another special touch that I do. I will make sure our senior team is included in the ceremony just because it makes it that more important and it has more of an impact to the staff who's receiving the award. And she also gives a brief history of the history of the foundation, DAISY Foundation. Then the CNE reveals who the honoree is and also reads the nomination out loud. This is a very sentimental part of it. Usually this is where we see the tears, and it's just the room fills up with a lot of feelings, which is, part of what DAISY is. So after that, obviously the CNE presents the award, the pin, and the certificate. Lastly, the manager closes the ceremony and she presents the Cinnabon. And along with that, we give the history of why we have Cinnabons included in the ceremony, and which always gives it that special touch. And at the end, we do pictures. We do a team picture because they always say this is a team effort. So we take a picture of the whole unit, and we also do a picture for an announcement that I later send out, and for obviously the website. Making the program meaningful. In addition to that, I like to highlight the program to staff and guests. We do so by obviously highlighting all the honorees throughout the hospital, but we also like to give spotlight to the nominees. So what we do is we give a packet out, and here's a picture of it. And they get this little letter note from our CNE, and I attach the nominee pin, which they always look forward to. And I also include their nomination story and their nominator. They really look forward to this, and they know it's coming because I send out an honoree announcement, and I'll show you what that looks like. So 2 hours after the ceremony, I send this out. It's a mass email again to everybody. And this is what it looks like. We make sure we highlight the honoree. This is our August 2022 honoree. We put their name, their unit, just a really quick Daisy description. And here we share his nomination story. In addition to that, we highlight the nominees, and this is why they know their packet is coming, because shortly after we distribute them to the managers, and we make sure that they also make a very special, smaller scale, but a nice little presentation for them. And so another thing that we do is, again, in the newsletter, we also highlight them as I showed you, and that also includes their nomination story, the same kind of setup that I just shared with you. During Nurses Week, we do a bigger special ceremony that actually Chelsea was able to participate in, and we definitely make that one a little bit more special. We go all out with decorations, we do soft hors d'oeuvres, refreshments, and we just invite all hospital leaders, everybody who's interested in coming, and we usually have a good turnout, but we definitely make it more meaningful. We also do the poster of the honorees with balloons just to make sure they pop out extra for that week. And that is all. I don't know if anybody has any questions, but again, the true meaning behind it is just to make every ceremony meaningful. And even the nominees, if you make them feel that it's a special, just getting a nomination, the word gets out. So they're more likely to mention to a patient, even if it's a coworker, oh, so-and-so came in, they were great with me. They're easy to be like, oh, here's a nomination, you should nominate them. So that's all I have for you guys. Thank you.
Wonderful. Thank you so much, Maciel. That was so great to see how you really promote your program, how you really highlight your honorees as well. Something that I did notice as soon as I walked into Tacoma General was what a culture of recognition is really spread throughout your facility. And we're so happy that Daisy is such a part of that. So thank you so much for all that you've done to make that possible.
Of course.
Any questions from anyone? Oh, London.
I wanted to know, do you edit this list of nominees and honorees on your own, or do you have a team that assists you with that?
No, unfortunately, it's always just been myself. Of course, with the ceremony, usually there's a team that goes with me, which is, to present the awards. But other than that, from the collecting the nominations, actually, I do get assistance from volunteers who go to each unit and pick up the nomination forms. But as far as the blinding and the, putting the packets together, I do sometimes get volunteers to help, but for the most part, yeah, I put all that, the flyers, the announcements, I put that together.
Thank you.
Great. Thank you so much. If no other questions, we will introduce our next speaker, who is Deborah Montano from the VA in Spokane. And I will let Melissa go ahead and pin Deborah there before I show a quick screen. Wonderful.
Good morning, or close to afternoon, everyone. I'm going to go ahead and share my screen.
Yes, just really quickly, I want to let everyone know that Deborah is a nurse recruiter, pathway, and magnet coordinator for Mann Grandstaff VA Medical Center in Spokane, Washington. I was also lucky to be able to go to one of her Daisy Award presentations during Nurses Week, and I'm excited for Deborah to be able to share with everyone what she does for her Daisy program. Great, go ahead, Deborah, and share your screen.
Thank you. Can everyone see my screen okay? Yeah. Okay,
Good.
great. Okay, well, as Chelsea said, my name is Deborah Montano. I'm the DAISY coordinator for the Spokane VA, Man Grant Staff VA Medical Center in Spokane, Washington. I'm also the nurse recruiter, and at one time was the Pathway Magnet coordinator. So have a lot of interchangeable roles that work well together. So just to start off with a little bit about our facility, with the VA, we are a federal facility. The Department of Veteran Affairs and our Man Grant Staff VA Medical Center here in Spokane is a large organization, and we provide a lot of nursing responsibilities in both the clinical and administrative practice settings. Our main campus is here in Spokane, Washington, but we also have community-based outpatient clinics in Wenatchee, Washington, and Coeur d'Alene, Idaho. Additionally, we have rural health clinics in Libby, Montana, and Sandpoint, Idaho, and Bonner, Idaho. And currently, out of all those areas, we have about nearly 1,866 employees, and about 588 of those are nursing staff, which includes nurse anesthetists, nurse practitioners, RNs, LPNs, and NAs. And just before I get into how we do our DAISY here at Spokane VA, just a little bit about our facility and our mission, because it really ties well into DAISY. Our mission at the VA is President Lincoln's promise, and that is to care for him who shall have borne the battle and for his widow and his orphan. We also have what are called I-CARE values and an action statement. And our I-CARE values are integrity, act with high moral principle, adhere to the highest professional standards, maintain the trust and confidence of all whom I engage, commitment, work diligently to serve veterans and their beneficiaries, be driven by an earnest belief in the VA's mission, fulfill my individual responsibilities and organizational responsibilities, advocacy, be truly veteran-centric, be by identifying, fully considering, and appropriately advancing the interest of the veterans and other beneficiaries. Respect, treat all those I serve with whom I work with dignity and respect, show respect to earn it. Excellent, strive for the highest quality and continuous improvement, be thoughtful, decisive in leadership, accountable for my actions, willing to admit my mistakes, and rigorous in correcting them. And so with that, the I-CARE values, we also have a call to action for all of our employees. And that action is for every veteran who has answered the call to serve, we ask each physician, nurse, and other healthcare professionals to give back. We honor their service with our commitment to care. And so I go over those because when we decided to do DAISY back in 2017, I had just started the role as the nurse recruiter and the Pathway and Magnet coordinator. And we really wanted something to highlight the excellence of our nursing staff. We had awards throughout the facility that highlighted, other staff from, food service to maintenance, but nothing that really highlighted those special moments that nurses have with patients and even with other nurses. And so we thought the DAISY Award was a great fit for this. When we created our DAISY committee, we knew because we are a small facility that we needed to have a fairly large committee. We have one chair, which is me, the coordinator, and then we have about 20 committee members. And we have so many members because not all of them are voting members all the time. And that's because we have a small facility. And so when we set up the committee, we wanted to include non-surgical staff as well as varying levels of leadership throughout the facility. So we have folks that are on our committee who are chief nurses. We have folks that are secretaries, who are program support assistants, who are social workers. And so we have a varied background of folks who are on our DAISY committee. We also, when we decided to partner with DAISY, we wanted to create a nomination that was meaningful to our facility. And so when we created our nomination and our voting criteria, we modeled it after the I-CARE values, which I'll show you here shortly how our nomination looks. And so all of our nomination criteria and voting is based on those I-CARE values I just went over. Nominations, we get quite a few nominations for as small of a facility as we are. We have signs throughout the facility that have little envelopes on them that have paper nominations that you can use. And it also has my name, my email, all my contact information. So if they just want to contact me to give a nomination, or if they want to email it to me or they want to mail it to me, they can do all that. Or they can put it in what we call the ballot boxes with those signs as well throughout the facility. We have social media. Our social media folks will highlight Daisy every now and then on Facebook, and we do get nominations that way as well. We have the table tents that are used on our inpatient unit to highlight Daisy. And then we also have a lot of laminated signs throughout our facility that are the QR code for nomination that people can scan with their phone. And then additionally, because people get asked, how do I nominate a nurse? It's also on our SharePoint site for our facility. So any employee can go on to our facility SharePoint site and go to the electronic version of the nomination form and either print it out or fill it out online. And then also, I've been very fortunate that I'm really find when you Google Daisy nomination on Google, and I get a lot of nominations that are even for our facility that I pass on to the appropriate facility, but we get a lot of nominations that way. We receive about 20 to 40 nominations every quarter. We do the Daisy Award 4 times a year, and we get 20 to 40 nominations. With those nominations, I collect them, and then I blind them. So before I send them out to our Daisy committee to vote on, I take them and I remove any identifying factors. If it's male, female, what unit they're on, if any providers' names were mentioned, anything like that, I take that out. And then when I send those out to the Daisy committee to vote on, they're sent out in an email form, but a blinded email form. So no one knows who's voting for that nomination period. So none of the committee members know who is actually voting on it. And then also, I am particular about who I send it out to because we're such a small facility that sometimes we have those who are on the committee are nominated or someone from their team is being nominated. So I avoid to send those out to those people that are on the committee. I give the committee a week to review the nominations and to vote. And they come back and I get all the nominations back and I tally the votes and give an average, and the one with the greatest average is our honoree. This is our nomination form. As you can see, the nomination form tells you a little bit about the Daisy Award, and then it goes through the iCare values, and then it asks, the nominator for their story. As like I said, there's paper forms, voting boxes throughout our facility. I will tell you that when I put out the paper forms, veterans especially, I don't know why, they like to take a lot of the paper forms. So those run out really fast around our facility because we have, like many people, an older population, and I tend to get a lot of them through the mail and a lot of similar nominators sometimes so that when they've had a really good experience. So that's kind of nice. But we do have the PDF fillable forms and the QR codes and, like I said, the social media. Because we are the federal government, just to kind of give you background, we don't have a lot of money for advertisement. So like everything that we do is in-house, and we've been very successful with it. It doesn't take a lot of money for your program to be successful. When we do, things, it's printed on our own, we laminate it on our own, and what's really nice is because our committee is so big, I can tap into so many of those folks and ask for help. So if I say, I'm printing off, these 20 QR codes, would you mind laminating for me and taking them to the clinic in Coeur d'Alene for me and hang up? And I've never had an issue with people not willing to help out, or it's been very nice because we are a small facility and we don't have an actual dedicated FTE to just doing nurse excellence or retention efforts like the Daisy helps us do. And this is our scoring that you can see here. We score based on our iCare criteria. Each nomination can get a score from 0 to 10. 0 is just meeting the criteria, and anything above and beyond that, if you get a point, it's 1 point, it exceeds the criteria, and if you get 2 points, it's extraordinary. So they can get a score from anywhere from 0 to 10. Then when we honor our honorees, our VA and our culture here at the VA is we love to celebrate. And there may not be a lot of fancy things when we celebrate, but we like to get together. And when we do so, it doesn't matter. It seems that if we have folks that telework, that are in the C box, they all want to watch the ceremony. So what I do is we put out an invitation the day before, and through an all-employee email, and you'll see it right there. Join us to celebrate extraordinary nursing. We do the date, the time, and the location, and we invite anyone that can come in person to celebrate with us to come. But we also put out a Teams link, and we videotape or video on our phones the entire presentation. So folks that telework, that are busy, can't get away from their patients, but still want to watch, can watch and see the celebration. Also, we're very fortunate because, like I said, we don't have a lot of marketing money or money to spend. We partnered with our local Cinnabon, actually our nurses association. We have a national nurses association named NOVA, and her name is Sharon at Cinnabon here in Spokane. She's very much a supporter of nurses and veterans and the DAISY, and so she partnered with our nurses association, and she donates our Cinnabon for all of our celebrations, which was very nice of her. So shout out to her. But then we celebrate our nurses. We have our social media folks there, and they do all of our pictures for us, and it's a really amazing time. And so that's kind of really all I have. Is there any questions right away?
Thank you so much, Deborah, for sharing. I also really love that you include a Teams link with your DAISY Award presentation, so that way you can have those hybrid attendance for people who aren't able to either attend in person, or leadership who can't make it, who's not there on site, but maybe working from home, etc. So that's a really great best practice. Any questions for Deborah for DAISY program? London?
Yes, Deborah, I wanted to know, were you able to partner with marketing, and did you go through your CNO, or were you able to engage with your marketing department directly?
We are a small enough size facility. I engage with our marketing department directly. We just engaged. We were so small. So in bigger facilities, you might have to engage with your chief nursing officer or chief nurse executive first, but in our facility, we do not.
Thank you, Deborah. And yeah, for VAs, I know it can be a little tricky as well, especially with budgets and things like that also. So we're really grateful, and it's really great to see what you have been able to do with your DAISY program and how you're really able to continue to market it and get those nominations coming in from your veterans.
Thank you.
Wonderful. Well, next we will have Carrie Lopez. I am going to head and share my screen really quick to talk about Carrie for a second. Carrie is the Director of Care Transitions and Patient Flow with Tri-State Health in Clarkston, Washington. Another wonderful program that I was able to visit during Nurses Week and go to an award presentation. And I'm excited for Carrie to be able to share how she runs her program at Tri-State Health.
Yes, thank you so much for having me. This is the first test right here, is to see if I can share my screen. All right, are we good? So, my name's Carrie Lopez. I'm the Director of Care Transitions and Patient Flow at Tri-State Health, formerly Tri-State Memorial Hospital in Clarkston, Washington. A little bit about our facility. We are a 25-bed critical access hospital in southeastern Washington state. We do have an inpatient area, those 25 inpatient beds, but we also have an emergency department, outpatient and inpatient surgery, outpatient clinics, a number of specialties, including dialysis, pain clinic, and more. We have 656 total employees, of which 165 are RNs or LPNs in non-leadership positions. And we started Daisy in 2020. We were looking to start on the pathway to excellence, and really needed a meaningful way to recognize our nursing staff, not only for pathway, but also just we needed a good solid program at our facility. So we started with the Daisy Award in 2020. We give out 3 awards per year, one in January, one in May, and one in September. And we picked those months because May, we wanted to honor Nurses Week and Hospital Week by having a presentation that month. So January and September just fell naturally. And then in 2023, we added the Daisy Team Award, which we also presented in May for the first time. And we just noticed we were getting so many nominations for the individual award, but from groups of people, or 4 groups of staff, 4 groups of nurses and care groups. And we thought, you know, we need a way of really recognizing them and not just individually. So we added the Team Award. Our Daisy Award Committee is part of shared governance. And we have 2 chairs. I am one of the co-chairs. The other one is Mandy Babineau. And then we have the committee is 15 members from across the organization. So as you saw, we have a number of outpatient clinics and other areas, and we want to make sure that everybody is represented on both of those committees. So one of the really important things for us, given that we do have a lot of kind of these satellite clinics, is keeping Daisy out in front of folks and making sure we're able to get nominations from all those patients that are seen at these areas. So when we promote Daisy, we have several permanent displays around our organization. We use banners, trifold brochures that are placed around campus. Our hospital website has a page dedicated to Daisy that has a link where people can nominate a nurse. We also have partnered with Press Ganey to put a QR code and links on the end of both our paper and electronic Press Ganey surveys. And we also do our meaningful presentations and our marketing group. They're amazing. They're in-house, so free of charge. Gotta love keeping the budget in line, but they really help us out with a lot of our efforts, and then the social media. And then we don't give anybody an excuse to not find a way to nominate. So we use QR codes, trifold paper forms that they can mail in. We have ballot boxes in waiting rooms. We have an electronic form on our website. It's a JOT form, and that's the same one that people are taking to from the Press Ganey surveys. We also have that QR code in surveys, and then anytime social media post is made, they make sure to put a link on there for us. So these are some pictures of some of our nomination methods. As you can see on the left there, we have a ballot box in our emergency department waiting area. And we really try to target areas where people are waiting or sitting for a period of time, where they have time to read the material or take one, fill it out, put it back. Our displays around the hospital, you can see they have the QR codes on them, so somebody can easily use their phone and access that nomination form. This QR code is, that's the wording at the end of the Press Ganey survey. This is an example of our JOT form on the website, and then the mail-in, the trifolds, because you know there are those groups of people who just appreciate pen and paper. So we want to make sure they have an option as well. And then our permanent displays. So we have been fortunate enough to move into a new building for our new patient area, med surgeon ICU. And I secured this prime location for us right across from the elevators. next to the bistro and the gift shop. You can see it on the wall right there. On the left is a little bit closer up. We have that display. It's actually made of metal. It has a QR code on there. It's got some really nice lettering. And then marketing makes sure to keep it fresh every time we do an award with the team member and the individual members. And then, of course, because we have an older section of our hospital that we just vacated, we have a display there as well. It's by a restroom, administration, and a cafe. So, of course, areas that are frequently visited by staff and visitors. And you can see there, it has the DAISY mission on there, previous winners, a QR code, and photos of staff who've recently received the award. So now that we are gathering all these nominations, how do I manage them? So marketing, like I said, I partner with them and they manage a lot of the brochures and everything out at the remote locations or outpatient clinics. So they go around and check those for me on a schedule. It's usually monthly. And then any email or electronic nominations come directly to the co-chairs via email. So as soon as that nomination is sent, I receive it. I use a nomination tracker to keep track of everybody in Excel. And then when it comes time to voting, I use a Survey Monkey. So I put all the testimonials, blinded, of course, in a Survey Monkey and send that out to all of our DAISY committee members. And that's open for about 1 week before I tabulate the scores in a different Excel spreadsheet. So this is an example of my nomination tracking spreadsheet. And it's really helpful to me, not only so that I can keep track of our team nominees, our nurses who are eligible, and then any staff that were nominated but not eligible, like a tech or an MA or a respiratory therapist. But then over here on the right, it'll automatically keep a count for me, which is super important because I now have a nurse in one of our outpatient clinics who's received 20 nominations. So I have had to order the platinum pins and the green pins. So I really want to make sure people are getting the right pin, and I'm giving them the acknowledgement that they deserve with those multiple nominations. So when it comes time to our presentations, we make it a surprise. We do coordinate with department leadership, and we try to do this during the honoree shift. So either before or at the end, but we do work with their director or leadership within that department to make sure it's not going to infringe upon patient care. But we want to make sure that their coworkers and everybody that they're usually with, their support group, is there with them. We always have our CNO and our CEO present, as well as the committee co-chairs. Our CNO and CEO have scripts that they read in the presentation guide. So it's very interactive and very meaningful because words are very much coming from our leadership at our hospital. And then marketing, again, they super helpful right here. They bring balloons, they bring a swag bag, they take the photos. Of course, we do daisies if we can. Cinnamon rolls. We don't have a Cinnabon here locally, but our cafeteria makes amazing homemade cinnamon rolls. So I always order a dozen of those. And then we get a couple things specific to our organization. So we have a Yeti cup that we get engraved with the recipient's name and our hospital logo and the DAISY on it, so that they can remember the good work that they've done, the honor that they've received. We also give them a gift certificate to the employee store. And then marketing, just, any other fun stuff that they have hanging around, like the free sunglasses and the hand sanitizer and all that good stuff. At the end of our presentation, the honoree will sign and date the banner, and we make sure that it's hung up in the department where everybody can appreciate it. So this is a picture of our new medical surgical unit. And on the left, and as you can see, they won the team award in May. And their banner is hung up in a very prominent spot right across from the elevators. So everybody coming off the elevators knows that this is a unit deserving of the award. We put a picture, you can kind of see a little bit there, of the staff. So I think it's a great connection between staff and patients and families to be able to say, oh, you won the Daisy Award. I saw your picture out there. That's so cool. And then the one on the right is our ICU. So an ICU nurse won in May most recently, and that banner is right adjacent to the nurses station. So again, with the photo, with the QR code so that anybody can see that and nominate the next potential honoree. So this is a picture of one of our award ceremonies. So we have our CEO, our CNO, of course, Mandy and I, department leadership, and the nurse. But we want to make sure that that recognition and that energy is continued. So marketing helps us by posting the photos on our social media sites. They update the hospital website. We have an employee newsletter that goes out the first Friday of the month called First Friday Facts. They always put that in there. And then they place a photo of the honoree on the banners and next to our displays. The honorees are registered with the Daisy Foundation. We have yet to have somebody not want that benefit. And then all nominees, so not just nurses or LPNs that would be eligible to win, but anybody who is nominated, receives a nomination, is given a letter with their the words recognizing them that is signed by the Daisy Committee. And then all of those letters are given to department leadership, and they are encouraged to present all the nominees with those letters, and if appropriate, a pin in a way that's meaningful to their department. So whether it may be at a staff meeting or something else, but we want to make sure everybody's able to enjoy. So tips that I would say that have worked really well for us is first to not honor all the nominees. As you saw earlier, we have 500 people who work at our organization who are not RNs or LPNs, but we value their contribution to patient care. So even though they may not be eligible for the award, we still want them to know that they're a valued member of our patient care team and that we appreciate them being a part of that team and the work that they're doing. We allow nominations to come from anybody. So staff, patients, families, providers. If somebody wants to take the time and effort to nominate, we will absolutely let them do so. And then a few other things. I always make sure to wear Daisy colors on any presentation day, and then any other time it feels right. So about once a month, you can catch me wearing Daisy gear around the hospital. And I really love that the Daisy Foundation has a new store. You can get some different swag. So I have a sweatshirt and a t-shirt and a scrub jacket and all that good stuff. So and I was also able to buy some stuff for some of my co-chairs as well, or my co-chair. So and our CNO. So you see Daisy stuff with us all the time. And then if you can, in budget permits, invest in displays. Put them in prominent areas so that people are constantly being reminded and seeing the Daisy program and who's winning, looking at the past honorees, keeping the material fresh and engaging, and then partnering with local businesses and hospital departments. We work hand in hand with our marketing department, but also our local businesses for the Yeti cups and our hospital for the Sun Meals. So that's what we have found successful for us. We average for a critical access hospital about 15 or 20 nominations for every award cycle, which I think is great. So that's all. Are there any questions?
Great. Thank you, Carrie. That was so great to see. And I love your side with the tips at the end. And I love that you wear your Daisy gear as a way to be kind of a walking billboard for Daisy and really encourage patients, visitors, staff to ask you about it. And then your permanent displays are so beautiful, and having those really strategic prominent locations, I think is really key to getting that information in front of your patients and families and visitors.
Yeah, definitely.
Questions for Carrie today?
We did have some questions in the chat about the multi-nominee pins. I did explain that the green multi-nominee pin is usually given out for nurses who have received 5+ nominations, and the platinum pin is usually given out for nurses who received 10+ nominations. But as stated, you can decide on the level that you want to give out the multi-nominee pins.
And how
Yes.
amazing you have a nurse with 20 nominations, and from an outpatient setting too. That's really great.
Yes, yes, she definitely is just one of those engaging personalities that really connects with the patients and makes them feel warm. And there's just every once in a while you run into those people who just make you feel like you're the only person in the room. And I think she does that. And I appreciate that our patients are willing to take the time and recognize her. So yes, it's because of her that I had to start investing in the multi-nominee green and platinum pins.
Wonderful. Well, that's great. And hopefully others of you, I see Lynn also asking about how do we get these pins. So obviously others have nurses who have received multiple DAISY nominations. The pins can be ordered directly through our resource center. There is that section for placing orders. However, you can always email me. Everyone, please feel free to shoot me an email, or my wonderful program specialist, Kate Annenson, who you've probably heard from as well. We can both help with that ordering of any DAISY items that you need, or if you ever have questions, always feel free to reach out. I'm going to share my screen again, and we'll talk about the next part of our event here. So next we'll be going into breakout rooms, and this will be where we can get into